scientists are developing a tablet that rebuilds tooth enamel and whitens teeth. This lozenge tablet is to be taken orally like a cough drop used to treat sore throats. Clinical trials will soon be launched by researchers on this genetically engineered peptide along with calcium ions and phosphorus. These form the bases of tooth enamel. Each lozenge deposits several micrometers of new enamel via the peptide engineered to bind to the damaged enamel. The teeth get repaired without harming the mouth's soft tissue. The new layer also integrates with dentin, which is the living tissue underneath the tooth's surface. The peptide is derived from amylogenin, which is the main protein forming the enamel, and of cementum, which makes up the surface of the tooth root. 2 lozenges a day can rebuild enamel, while 1 lozenge a day can maintain a healthy layer. It is expected to be safe for children and adults. The enamel will be whiter than obtained through commercial strips or gels. Researchers claim the lozenge strengthens, rebuilds, and protects teeth. Many factors contribute to teeth being discolored. Mostly, the stains are external, affecting only the tooth enamel. In this case, the discoloration can be corrected. Foods and drinks that create an acidic environment in the mouth can make the enamel prone to staining. Soon, we should expect an easy cure for stained teeth and damaged enamel.